Good morning, everybody. We're going to get started in about 3 minutes. So if people could start taking seats. And if possible, if people could sit, don't be shy and come towards the front. I don't want to be the only one sitting in the front row. Thank you.
Good morning. My name is Robert Williams, and I have the pleasure of serving as the Executive Director of the New York State Gaming Commission, which touches upon all aspects of lawful gambling activity in the state. When we were founded in 2013, senior commission staff were surprised to find that the state's gaming regulatory structure had not established any formal relationship with either of the two major organizations involved with problem gambling: the New York Council on Problem Gambling and the Office of Addiction Services or Supports, or OASIS. The lack of these relationships led to the creation of the Responsible Play Partnership, a tripartite organization formed in part to ensure that the New York Council has direct and continuing access to Commission and OASIS leadership. The Commission is a regulatory agency. We are most certainly not problem gambling experts. Nevertheless, we've never avoided the issue of problem gambling, and we have tried to make a positive impact. Our general approach to responsible gaming has been to provide education and increase awareness, be responsible in our provision of gambling opportunities as we operate the New York Lottery and the video lottery gaming facilities, and to do what we can to support professional services and problem gambling resources. To this end, the Commission has undertaken several specific actions that we believe have fostered a responsible gaming environment in the state. For example, before commercial casinos were legalized, the Commission conducted a public forum focused on problem gambling, which brought together professionals, advocates, and academics to guide the development of an industry best practices framework for gaming operators. The request for applications that flowed from the commercial casino legalization contained stringent requirements for bidders to include comprehensive responsible gaming plans. Not only was the requirement to include it part of the RFA process, but it was actually a graded segment. And that continues with the new process that we're undergoing for the downstate licenses as well. Before the law required it, the Commission established, standardized, and expanded a self-exclusion policy to allow people to self-exclude from all forms of legal gambling in the state. We have also mandated responsible gaming training for our 15,000 New York Lottery retailers to ensure that they understand the role they play in youth gambling interdiction. Last year, we created the nation's first ever QR code, which I think was down there on the table, which provides direct access to problem gambling professionals. And it's on the back of every scratch-off lottery ticket that's printed now. We've also produced multiple radio and television public service announcements each year with the goal of raising awareness of problem gambling and to publicize the Hope Line. Working with the New York Lottery's media purchasing agency, Universal McCann, we have been able to place these public service announcements free of charge during optimal viewing or listening times, resulting in a total fair market value of $9.9 million and hundreds of millions of impressions. And with the Responsible Play Partnership, we annually conduct multiple problem gambling awareness events across New York to drive the attention to the issue of problem gambling. Last year, New York's gambling landscape shifted as mobile sports wagering was authorized. I'm certain everyone here has heard the advertisements as they have been ubiquitous. While much has been written regarding the volume of mobile sports wagering play, there has been little public attention of the mobile sports wagering laws and regulations related to problem gambling and controls regarding advertising and promotion. For instance, when an account holder has a lifetime deposit exceed $2,500, The mobile sports wagering operator must freeze their account until the patron acknowledges that they have met the deposit threshold. At that time, they are given an opportunity to establish problem gambling limits or to close their accounts. And annually, they have to go through that exact same process again. Additionally, commission regulations also require that all mobile sports wagering advertising contain problem gambling messaging and information about the Hope Line. We've understood that there's been increased attentions to the Hope Line, and we're proud to play an effort in at least getting that Hope Line out there so people can contact it if they feel the necessity. Just last week, the Commission unanimously voted to advance a package of new rules that would, among other things, firmly establish licensee responsibility for the content of their advertising, marketing, and branding, prohibit false, deceptive, or misleading statements, require marketing and promotions to clearly and conspicuously disclose material facts, terms and conditions, and the like to potential customers. It also will require an opt-out functionality to block receipt of future direct advertisements. It would prohibit designs aimed to appeal primarily to underage patrons, prohibit advertising to a target audience that is reasonably foreseeable to comprise underage persons, and prohibit advertising on college and university media. We understand at the Commission that we play a very minor role with problem gambling, but we will continue to do our best to make the Hope Line noticeable and in raising awareness regarding problem gambling. While we are not problem gambling prevention or treatment experts, we do know a few people who are. To that end, I'd like to introduce Dr. Chinazo Cunningham, who is the Commissioner of the New York State Office of Addiction Services and Supports. Dr. Cunningham previously served as the Executive Deputy Commissioner on Mental Health at the New York City Department of Health and Mental Hygiene, was a practicing physician in the Montefiore Health System, and a professor of medicine at the Albert Einstein College of Medicine. Dr. Cunningham has trained hundreds of doctors to treat substance abuse disorders in primary care and has led several research studies and published numerous research articles that focus on treating substance abuse and disorders. Please welcome Dr. Cunningham.
Thank you so much. I'm happy to be here today, and I just want to acknowledge Robert Williams. Thank you for organizing this event. Jim Maney from the New York Council on Problem Gambling, and Keith White from the National Council on Problem Gambling. And really, you know, it's the 20th anniversary of Problem Gambling Awareness Month, and so clearly there's been a lot of progress bringing attention to this issue. And I'm really happy today to later present the proclamation from the governor about Problem Gambling Awareness Month. So as gambling opportunities increase, it's critical that the state is ensuring prevention, treatment, harm reduction, and recovery services. And we definitely appreciate the true partnership that we have with the New York Gaming Commission and the New York Council on Problem Gambling. We heard about the Responsible Play Partnership, and it's in its 10th year of existence, and it brings together stakeholders to address problem gambling. And that includes the gaming facility operators and treatment providers. It ensures that the gaming entities comply with state rules and regulations. It provides information to people regarding access to help for those who need it. And it also includes the voluntary self-exclusion programs. So I would just want to take a minute to talk about some of the initiatives that we're doing at the state level in our Office of Addiction Services and Supports. So in partnership with the New York Council on Problem Gambling, we provide training to prevention specialists. We certainly develop relationships with local and state level businesses and groups to increase awareness and support. We support trainings for individuals and family members and also provide peer support. We have a Stick to the Game Plan public awareness campaign that ran through the Super Bowl and is continuing to run through March Madness with the NCAA basketball championship. And we have a significant social media presence for Problem Gambling Awareness Month. We also were working with the State Department of Education to provide guidance to youth, really focusing on prevention for underage gambling. In terms of treatment, we also partner with the New York Council on Problem Gambling to provide support to 7 regional problem gambling resource centers. And through these, they facilitate referrals and access to treatment in collaborating with 129 private practitioners who have specialized training and certification through our agency. We also provide training and education to other clinicians throughout the state. We have 36 outpatient treatment programs that specialize in gambling treatment, and problem gambling treatment is also available at all of the 12 state-run addiction treatment centers. We also, I'm very proud to say, we also have a specialized gambling designation and training for our substance use counselors, so that this is another pathway where professionals in the field of addiction can get gambling, additional gambling training and expertise. So it's critical that we make sure that those who need help have help and that access is readily available. You heard about the QR code. We're pretty proud about that, being the first in the nation, so that people can easily access problem gambling resources. We have the Hope Line, which is available 24 hours a day, 7 days a week, again, for resources and guidance and referrals. We've changed our homepage website so that problem gambling is elevated and, again, easy to find access and services. Also, one thing that's very important for us is to make sure that we are providing all of our services by following the data and providing evidence-based strategies. And so one of the ways that we're doing is making sure we're really closely monitoring what's happening across the state, and some of those ways include monitoring the Hope Line calls to see that if inquiries around problem gambling increase, that we are ready and available to provide that support. We're also closely following treatment admission rates, again, so that if there's an increase, we can easily expand services. And then finally, we're also conducting our own statewide surveys among young adults and youth following gambling behaviors over time, again, to make sure that if we see an increase in problem gambling, that we can easily address that. So we at the Office of Addiction Services and Support, we're stand ready in partnership to make sure that we have adequate resources and services to address those in need. And so I thank you, everybody, for being here today. I really appreciate the ongoing partnership, and it is a true partnership that we have. It's really a model for other areas across the state. And together, we're all needed to make sure that we continue to raise awareness, that we continue to help families and individuals and communities to make sure they have the resources they need across the state. So thank you very much.
Thank you, Dr. Cunningham. Next, I would like to introduce the Executive Director of the New York Council on Problem Gambling, Jim Maney. Earlier this week, Jim hosted the 2023 edition of the New York Council on Problem Gambling annual conference, where Dr. Cunningham and I were honored to participate. The conference brings together researchers, legislators, counselors, and other problem gambling experts from across the world to provide diversified training in prevention, treatment, and recovery for New York State's problem gambling professionals. Jim and his staff are passionate about problem gambling and increasing awareness about problem gambling. And anybody who's ever spent any time with Jim knows exactly how passionate he can be. He is a tremendous advocate for support services and treatment for persons who are adversely affected. Please welcome Jim Maney.
Hello, everybody. Just excited to be here. I just want to thank Dr. Cunningham, Rob Williams, Keith White, Lee Park, Carolyn Hateman, Sharon Robinson, Addison, Brad Mayone, Pat Zuber Wilson, Venus Moore, Elisa James, and last but not least, Michelle Haddon. Because it is, as Dr. Cunningham said, this is a partnership, but it's just not a partnership with the four of us. It's a partnership with all of us. You guys in the audio, video, and taking pictures, and guys from McCann doing the digital ads. It's all about all of us. Because this is the one thing that we need everybody involved, right? And when I sit on the podium with, I feel like Ringo Starr. You know how Ringo had George McCarthy and John Lennon, you know, right? And Paul McCarthy. And I'm like Ringo Starr. I bring it along for the ride, you know. And I will say this, that I've been involved in the problem gambling field since 1996, and I've been the executive director for the council since 2021. And if we did this press conference 16 years ago, it'd be me and Michelle, and they wouldn't have any lights on, and there'd be nobody here. And so you think about the progress that we've made in just advocating for problem gamblers and their families, and to have these folks involved and all you involved, we have a chance for really the first time. We have a chance to make a big difference. You know, in the council, we only do two things. We raise the awareness of problem gambling in the state of New York, and we get help for folks that need it. We don't take a stand for or against gambling. We don't deal with legislation. We don't deal with any of that stuff. And it keeps it real simple. Our job is to be helpers, to show care and concern. So what we do, we have a website. If you go to NY Problem Gambling, on that we have everything available for anybody that needs it. We have a training center where there's free training to learn everything you need to learn about problem gambling, right? We also offer any type of training to any organization in the state of New York that needs it. Either remotely, we'll come to your office, and we also provide treatment services along with the folks at Oasis. We have 132 private practitioners that we can send folks to. And the way we like to view that is we want to get folks help in their language, in their community, and wherever they're going to have the best success for success. And on that website also, we have a map that shows where you can get services and help and where the PGRCs are. And we offer a variety of things. We have so much literature on our website about youths, about parents, about how to talk to your kids about gambling, seniors. Anything you can imagine, we have done. We've done it in many different languages. And once again, I am so excited. I use that word a lot because of where we're going to be. Now, 20 years ago when we started PGAM, I was there, and it was the beginning. And then you think about where it's going today. But what most excites me about everything is tomorrow. The promises of tomorrow, when we put our mutual work, dedication, devotion together, there ain't no stopping us. And who we serve are the folks that are having challenges. Not the folks just today, but the folks in the future. Our grandkids. I mean, I have 3 young boys that are grandchildren. Hopefully they never become problematic gamblers, right? So our work will never be done. Our work will never be done. But I think the motto is, and I'm not a Latin scholar, you know, U primus juno, whatever that is. What's the state motto? I know, I didn't take Latin, I took German. I know, Pat and I went to the same high school. She went to the girls' part, I went to the boys' part. We didn't take Latin in the boys' part. So, you know, what I know it means out of many become one. And that's what we are today. And I appreciate everything that everybody does for problem gamblers and their families. So thank you very much.
Thank you, Jim. Finally, I'd like to introduce the Executive Director of the National Council on Problem Gambling, Keith White. Founded in 1972, the National Council on Problem Gambling serves as the national advocate for programs and services to assist people and families affected by problem gambling. While Keith has been at the National Council for nearly a quarter century, he previously served as the Director of Research for the American Gaming Association and at the American Bar Association section of Individual Rights and Responsibilities, where among other policy issues he dealt with was health care. This March marks the 20th anniversary of the National Problem Gambling Awareness Month, an initiative designed by Keith and his compatriots to educate and raise awareness about the issue of problem gambling and to promote resources for those affected. We are very fortunate to have Keith to talk about his experiences, what Problem Gambling Awareness Month means, and what resources for individuals and organizations are available. Please welcome Keith White.
Thank you very much. Thank you to the Commission, to Oasis, to the New York Council for having me here today. I am reminded of the Beatles song, it was 20 years ago today. And as Rob said, I appreciate my bio because we actually met almost 30 years ago when we were both working in the gambling industry. And I think it is part of that experience that's helped shape events like Problem Gambling Awareness Month and the Responsible Play Partnership. Because I think then and now, we are better together, as Jim said. So it's really with just profound gratitude that I'm here today because also, as Jim said, 20 years ago and 30 years ago, the problem gambling was not a popular issue. We weren't filling conference rooms. We weren't bringing the quality of people that we have here today together. And so it's nice to have that arc of history. It's nice to be in a field long enough where you can see real change. Real change across the entire United States, real change here in the Empire State. When we founded Problem Gambling Awareness Month back in 2003, we were sort of naive enough to think that we can just create an awareness issue, but it turns out you can. So if you have an orphan issue, if you have an issue that you care about in your community and you want to raise some awareness, I might recommend creating a event. And you put it on HHS's National Health Observances calendar, and voila, you've created awareness. But what it takes is not me, but it takes everybody else to pick that up. It takes everybody else here to then say, we want to be part of this. We want to do something. We want to contribute. And here's our particular contribution, because Problem Gambling Awareness Month is at its heart a grassroots approach. That's how we change hearts and minds. Yes, we can proclaim a month, and yes, we can put some materials on our website, but it's really what each and every one of you picks up, and not just using our materials, but then you create your own. You create awareness in your own communities. We tell people if all you do during Problem Gambling Awareness Month is take one flyer and stick it at one local coffee house, you've created awareness, because we never know when there's that one moment of clarity, when that person behind you in line for coffee, that may be their last dollar. They have just literally gambled $5,000, $10,000, $20,000 that morning. They have no idea how they're going to pay that back. They're in such a desperate state. The walls are closing in. They have no idea how they've got to where they are. They just know that they can't tolerate it anymore. And when they're there, when they see that one flyer, with that one little tear off that says, call the helpline, because not just that there's help, but there's hope. All addictions, as Dr. Cunningham knows, breed and fester in that shame and silence and stigma. And when you can help break that barrier down for just one person, and if everybody helps just one person, all of a sudden, then that starts to snowball. And that's one of just the wonderful things I've seen over the past 20 years, is it starts to snowball and snowball even more. And the more we do, the more awareness there is, the more people start to realize that this is a preventable and treatable issue. And then the more we all can dig in and say, hey, here's the next thing and the next thing. Because as Jim knows, and Jim has taught me a lot about advocacy, as Jim knows, yes, we want to celebrate where we are today, and we are, but there's also so much more that needs to be done. So I am deeply, deeply grateful to be here. And when we created Problem Gambling Awareness Month, we had heard both from recovering gamblers, and the National Council on Problem Gambling was founded in 1972, as Rob said, by recovering gamblers and by the treatment community to be that national advocate. But we've heard from them consistently, and still today, that when they were in the healthcare system to treat a substance abuse problem, their depression, they were talking to a financial counselor, every time they were in the healthcare system, they were never asked about their gambling. They were never screened for gambling disorder. And likely, even if they were, there would probably be nowhere to send them. So we heard that from the recovery community. And we also confirmed it with research. Problem gambling, as Dr. Cunningham said, is highly co-occurring. You know, it goes along with many of the other risk-taking behaviors. And there's a lot of things that problem gamblers experience that will bring them into that healthcare system. So that the simple thought behind Problem Gambling Awareness Month, which was true then and is true today, is to ask anyone in the healthcare system to talk to their clients, their patients, about gambling, to ask them those questions, to have that conversation. You know, there are simple screening tools available on Oasis's website, New York Council's website, our website. This is not, and it doesn't have to be a 500-person screen, 2 questions, 3 questions. That at least, even if the simple question is, do you gamble? It took me 15 years to get my physician at my annual medical checkup to ask me about gambling. He knows what I did. He's actually a New Jersey guy, and so we talk a lot about, he and my wife are both from Tenafly, New Jersey, oddly enough. And so we talk a lot about gambling. But every year he'd ask me, do you drink? Do you smoke? You know, do you use drugs? You know, no. And then I'd say, well, Dr. Amici, you know, what about gambling? Oh, yeah, but it's not on our form. All right, so now 15 years into this, it's now on his form. So for the last 3 or 4 years, he has asked me at my annual physical each year about whether or not I gamble. Just one simple question. And he now asks that of all his patients. And that's the simple ask. That's the simple ask in 2003. That's the simple ask now today. There is a lot more you can do. You know, you can light up the entire Empire State Building and all these other historic monuments and facilities throughout the state. And that symbolism creates enormous awareness. You know, the proclamation that we'll see in a moment is incredibly helpful because it tells the general public, you know, even when you're not in a healthcare setting, this is a real issue. And again, it's a real issue that there is help and most importantly, hope for, because most people who are in that spiral of addiction, what they lack the most, what they need to hear the most is hope. That you too, that there is a pathway out of this that's a positive direction, not that negative downward spiral that's so easy for all of us to get into at times in our lives. So today, we celebrate Problem Gambling Awareness Month, and we hope that you all help us through these many initiatives to talk to those, to communicate to those who are hiding in plain sight, you know, who are right there among us, and who may be suffering in silence. Because these partnerships are so powerful. And that's why I'm so grateful to be here today. And I just want to appreciate and congratulate the Commission, Oasis, the Council, on everything that we've done today. You know, happy 10 years for the Responsible Play Partnership today. And here's to another happy 10 years. Just imagine, as Jim said, what we'll do tomorrow. You know, imagine how many folks might see this live stream today and think, oh, I'll make that call, or I'll talk to someone, or I'll say, hey, you know, I know that you can get some help. You know, that you can reach out, and when you offer that hand, they can come and take it. Because that is the ultimate goal. So again, it's with my profound thanks that I'm here today to be here to recognize this event with you, and I look forward to working with each and every one of you. Thank you again very much on behalf of the National Council on Problem Gambling.
Thank you, Keith. At this time, I'd like to invite you all back up here, Jim Maney, Dr. Cunningham, and Keith, so that Dr. Cunningham can present a proclamation from Governor Kathy Hochul to the New York Council on Problem Gambling, formally recognizing March as Problem Gambling Awareness Month.
This way?
So I'm very proud to be able to present this proclamation from the governor, and I just want to take a minute to read part of this. During this month, individuals, professionals, and organizations throughout New York State are called upon to renew their shared commitment to educating the public about problem gambling, the effectiveness of prevention efforts, and the availability of treatment services so that hope for recovery reaches people and communities across the state.
If I could say just a couple words. Thank you. I'm not crying. I got a little choke. But I humbly accept this proclamation from Dr. Cunningham, from all of us, and especially from the folks that don't have a voice today, the folks that are suffering, right? I accept it for them because that's what it's about. I mean, Dr. Cunningham, first day I met her, said, I'm all about saving lives. And that's what we do. And so under your leadership, appreciate that and accept this for each and every one of us, and especially those that don't have a voice. Thank you.
Thank you very much for your attentions, and that concludes today's presentation. Again, thank you very much.